NMB, PVC, and RNMC are terms associated with cardiac electrophysiology. NMB stands for no measurable blood, PVC refers to premature ventricular contraction, and RNMC indicates rapid narrow complex tachycardia. When evaluating a patient presenting with RNMC, the presence or absence of NMB can sometimes lead to confusion. It is crucial to understand the limited diagnostic value of NMB in the context of PVC occurring within RNMC. First of all, NMB is not a reliable indicator of PVC in RNMC. This means that PVC can occur without causing any detectable NMB. Conversely, NMB is not specific to PVC. It can also be observed in other types of arrhythmias, such as supraventricular tachycardia, commonly known as SVT. Secondly, the prognostic value of NMB in RNMC is also limited. Studies have consistently demonstrated that the presence or absence of NMB does not correlate with worse clinical outcomes in patients with RNMC. Specifically, it does not appear to influence the risk of stroke, death, or other adverse cardiovascular events. Thirdly, NMB is not an indication for any specific treatment approach in RNMC. The appropriate management strategy for RNMC is determined by the underlying cause of the arrhythmia and the patient's presenting symptoms, rather than the presence or absence of NMB. Fourthly, NMB can sometimes be mistaken for a bundle branch block, abbreviated as BBB. Bundle branch block is a condition that affects the electrical conduction system of the heart, resulting in a widened QRS complex on the electrocardiogram, also known as EKG. This widening of the QRS complex can sometimes mimic the appearance of NMB and also can lead to a loss of R wave progression. The distinction between NMB and bundle branch block is essential to ensure accurate diagnosis and appropriate treatment. Considering additional factors, NMB may be more frequently observed in patients who have had RNMC for a long period. It is also more likely to occur when the PVC are frequent or exhibit a multiform pattern, meaning they originate from multiple locations within the ventricles. The interpretation of NMB in the setting of RNMC requires caution and should not be the sole factor driving diagnostic or treatment decisions. Instead, it should be considered in conjunction with other clinical information such as the patient's symptoms, medical history, and other findings from the electrocardiogram or other diagnostic tests. In summary, understanding the relationship between NMB, PVCs, and RNMC is crucial for accurate diagnosis and management of patients with these conditions. Recognizing the limitations of NMB as a diagnostic and prognostic marker, as well as its potential to be confused with other conditions like bundle branch block, is essential for optimizing patient care. The information presented here is for educational purposes only and should not be considered medical advice. Always consult with a qualified healthcare professional for any health concerns or before making any decisions related to your medical care.